Welcome. This is Noor Zaza. Today I'm presenting research proposal to measure the relationship between breastfeeding peer support and breastfeeding duration in Kuwait. Breastfeeding is the best start of the life of newborns. It provides adequate nourishment. It provides the need to be touched, held, and kept close to their mothers. Breastfeeding is one of the most important public health investments because infant feeding for the first 2 years plays a significant role in their childhood, adolescence, and adult health. Breastfeeding is not easy and might not be the mother's choice for several reasons. Yet, for those who choose to breastfeed, breastfeeding support and living in a society that accepts and normalizes breastfeeding are very important success factors. Breastfeeding numbers in Kuwait are low. They are lower than some neighboring countries, and women who are deciding to breastfeed often do not know how to seek help in Kuwait. Peer counseling has many positive effects on breastfeeding rates. It helps breastfeeding women, reassures, empowers them, and normalizes breastfeeding in their society. While breastfeeding is providing this best start in life, breastfeeding numbers are not measuring up to the global standards. Also, peer counseling has been demonstrating to work, so a look at peer counseling efforts in Kuwait will add literature to this topic. The purpose of this research is to evaluate the effect of breastfeeding peer support helpline in relation to breastfeeding duration. The hypothesis would be that breastfeeding support helpline increases rates of breastfeeding at 6 months. Literature review. Benefits of breastfeeding. Breastfeeding is essential to infants' health. It is the ideal nourishment that provides infants with best source of adequate nutrition. Breastfeeding has a role with disease prevention and immunity development. Breastfeeding also reduces the risk of sudden infant death in addition to protecting the child from diarrheal episodes, respiratory infection, obesity, allergy, and asthma. World Health Organization and American Association of Pediatrics recommend exclusive breastfeeding for 6 months and continuing to breastfeed with introducing solids that are age suitable till the age of 2 years or more, according to the wish of the mother and the baby. Formula feeding is considered nutritionally acceptable, yet it is related to higher mortality and morbidity rates compared to breastfeeding. Allergy and obesity are related to accelerated growth during infancy that happens with formula feeding. There are many factors affecting mothers' decision to breastfeed or not to. The decision not to breastfeed might be affected by the lack of awareness in the community, lack of education regarding breastfeeding benefits, and the lack of support that women go through when they have any difficulties. In a study published in 2014, conducted in Kuwait, the results indicated that only 26.5% of mothers participating in the study had continued breastfeeding for 6 months or more. Some of the reasons that led to women early cessation of breastfeeding can be separate family housing, higher maternal age, late initiation of breastfeeding, being employed without feasibility to breastfeed at work, breastfeeding information given after rather than before birth, and maternal and infant sickness. Father's support is an essential factor that encouraged mothers to breastfeed. One of the important factors that lead to women stopping to breastfeed is lack of support. It is harder to continue breastfeeding without support. Women also find it easier to breastfeed longer when they have community support that help mothers normalize breastfeeding. Breastfeeding counselors are women, and most of the time they are mothers who are passionate about breastfeeding and are volunteering to provide mothers with breastfeeding relevant information, reassurance, confidence, and empowerment. There are different breastfeeding trainings in the market. WHO has a breastfeeding counseling training for a duration of 40 hours. It provides participants with skills to assist women to breastfeed. It provides these skills through breastfeeding and lactation evidence-based knowledge, counseling and listening skills, and practical help in maternity ward or breastfeeding clinic. Breastfeeding Support Program in Kuwait aims to assist women in Kuwait and the region to breastfeed by offering several breastfeeding support services, from education to a helpline and home visits. It also provides support groups and other types of gatherings to support women breastfeed in Kuwait. Methodology. All participants will be given informed consent before enrollment to the study. Mothers eligible for this study are going to be 16 to 45 years old, English speaking fluently as first or second language, had received the education in breastfeeding antenatally. There will be 3 groups. Group 1 is the control group, only receiving antenatal education. Group 2 will receive antenatal education and phone counseling. Group 3 will receive antenatal education, phone counseling, and home visits, 1 to 3 at least. Women will be answering a validated questionnaire that is attached in the appendix, and they will answer questions related to their breastfeeding exclusively for 1 month, 3 months, and 6 months. Measuring the numbers and percentage of women who are breastfeeding in these three groups, and using an ANOVA test, measuring the mean of these different data sources running this ANOVA test. The time of the study will be for a year to make sure that we are having women who have antenatal education and later birth and 6 months of the baby's life to have the adequate information. The importance of this research relies on that in Kuwait there are first low numbers of breastfeeding, so knowing if peer support is relevant to increasing these numbers, then that will help us in Kuwait to improve services related to breastfeeding and to increase our breastfeeding numbers. Another important of this research would be that there are low numbers of research in this area in Kuwait in relation to peer counseling and breastfeeding, so that will help the research in this matter. Limitations are that breastfeeding has so many factors involving the woman's knowledge, the woman's ability to breastfeed they are affected by so many factors, so determining which factor is leading to women succeeding and completing to breastfeed is not going to be determined accurately. Thank you.